I was actually invited to go to Seattle for the NFL cheerleading alumni reunion in October, and I came to Isabelle in August and said, "Help! What can I do to look my best and feel my best?" I hadn't seen a lot of the ladies that I used to cheer with. I hadn't seen them since my last year in 1991. And we're all in our 60s or 70s. So I just wanted to look my best, feel my best. And I think confidence is my superpower. Being in my mid 60s, I was approaching age spots, sunspots, and wrinkles. So, really, what I came to my consultation asking questions and my goals were was to make sure that I could get rid of age spots, sunspots, and wrinkle texture, all that.
Taking that into consideration, so we're working a lot with actinic damage, which just means essentially damage from the sun, pollution, natural aging. So we did a series of laser treatments on her, which included IPL for her pigmentation, so evens out the skin tone, gets rid of any darker brown spots. And then we did some laser resurfacing as well, just to get some boost in collagen production. With that boost in collagen production, things she can see is just better skin quality. So her skin's going to be thicker, it's going to be smoother, her pore size is going to decrease. And then we also touched on just overall facial balancing. So as she's aging, she's noticed some static lines, which just means lines that kind of etched in on her forehead, in between her eyebrows here, around her eyes. So we did some Botox treatments, as well as some filler just to bring volume back into the face where she starts to lose it, as we naturally do when we age. I think a lot of times people come in with like an event or an idea in mind. They either have a son or daughter's wedding, or they have a Christmas party, or they're doing something special or meaningful to them, and they're not really sure what it is that's bothering them about themselves. So a lot of times it's on us as providers to explain to the patient, hey, this is why this is happening. This is why these certain things are developing. They're normal, they're natural, it's beautiful to age, but we have a couple options that can help make it happen a little more gracefully.
And that's really what I came to Isabelle for during my consultation. I was like, I probably need a lot of filler, I probably need a lot of Botox. And she was like, in order for you to really reach the goals that you're looking at, is laser is really going to be your best treatment. I had never done laser before. Isabelle explained the options, and then she explained the process, including pricing. She wanted to know what my budget was. And so we were able to come up with a plan that worked for me and my family. Wasn't a lot of downtime, so that was encouraging for me.
Everyone's plan is so different because there's a lot of different factors. So a consultation is really key. Spending a lot of time getting to know them. What is their budget? What does their lifestyle look like? What is their medical history? Are there any skin conditions that we're working around? What is their dedication level? A lot of different anti-aging and a lot of treatments in the aesthetic world, they come with a price tag, and it's an investment in yourself and your skin. So I try to tailor it so that we're protecting your investment. A lot of times we start just with the basics. What are you doing at home? How much water are you drinking a day? How much sleep are you getting? And what does your skincare look like? We always start by optimizing that first. For example, when I told her you need to start on a strict medical grade skincare regimen before we even think about doing a laser or any kind of injectables, that's really important, because if you're not working at home to kind of protect these investments, and there's only so much I can do in the office.
You can see even when I'm talking or when she's talking, how she's really studying my face. That's just the mindset that she has. That's just the way she is. And she's constantly trying to think of, okay, we tried this, but maybe we can do something else. Let's change it up. The thing I noticed immediately after my first IPL was speckly dots that come out. It's almost like coffee grinds on my skin that literally just flaked off. And with that flaking off, behind it left a very pure complexion.
It takes a normal skin cell to go through its normal renewal process about 12 weeks. So with any treatment that we're doing, for example, for Kathi, we're doing these 2 different kinds of laser treatments. She won't start seeing the benefits, although she is seeing the little bit of the flaking that's happening, and it's quite satisfying to see, actually. She's not seeing her full benefits until about that 3 to 6 month mark because of that normal skin cell renewal cycle. Now, injectables are a little bit different. Sometimes you're seeing benefits with filler right away, same with Botox, but overall, it takes your skin time to incorporate these things into itself. I think it's really important too, as a provider, to make sure you're accessible to patients, because I do get a lot of patients who come here from other facilities, and when talking about what they enjoyed or what they disliked about those other facilities, a big thing to them was, I just didn't have access to ask any questions to. I didn't know how to get a hold of someone. If I did get a hold of someone, it wasn't easily accessible. I give someone our direct line of contact. They're very aware that they can reach out to me, and if they have any type of concerns, I'm usually having them just come in. We make small spots in our schedule to be able to do so that you're not going to have to wait 6 weeks to come in because you're concerned about something we did yesterday. It's nice and it's comforting to patients knowing that we are a dermatology office and knowing that we do come from a dermatological background. So if at any point I see something that looks suspicious, or we recognize that the patient has not undergone a skin cancer exam, we're always kind of bringing that up, and it's just a walk away.
Absolutely. It was, or is, a big part of my experience, because I do have a history of squamous cell carcinoma and basal cell carcinoma. I don't want it to get to melanoma, so just having my regular annual skin exams. So the initial consultation, I was introduced to getting ready for laser. We made a plan, and Isabelle told me which products that would be helpful for me. From the time of the consultation, I purchased the products, got on a regimen for a couple weeks, had at that consultation had made my first laser appointment for 2 weeks later. And so I was able to be on a skincare regimen for 2 weeks before I even came in for my laser treatment. We purposely did my face first just to see how it's going to respond to the treatment, and then my hands. So Isabelle thought that that would be helpful too, because obviously your hands are really going to show your age. In between, after my second laser, 2 weeks after that is when we did Botox and filler. And then I was sent on my way to Seattle on a 5-hour flight, drank a lot of water, showed up to the reunion to see some of my closest friends, acquaintances, people I hadn't seen before ever because they were newer. And the response, in fact, I texted Isabelle and told her everyone's saying that I look so great. So obviously a lot of my friends are my age. So they'll ask, what is it that you're doing? I want to try to get rid of this or that. And then I can suggest, or, from firsthand experience, explain what has worked for me. But like Isabelle said, it's really not one prescription for everyone. I have used to be a flight attendant for 20 years. I traveled a lot. I was a sun worshiper on my layovers, Cabo San Lucas. So I have all these freckles and sunspots thanks to Mexico.
With everything being so specialized, just making sure that patients know, you're not the only one and you're not being vain. That's the first thing people say to me all the time is, I'm embarrassed to be here, or I don't want anyone to know that I'm here, or I myself don't feel okay being here, and just making sure that they know it is completely normal to go through the normal aging process. And although everyone ages a little bit differently, we all go through the same anatomy of what's happening with aging. We're all losing bone density. We're all losing fat pads and muscle mass. We all have gravity kind of take a pull down. So once you break it down to the basics and explain to them what's happening and how it is happening to everyone, they feel a little bit more comfortable to then kind of dive into, okay, what exactly bothers you? What doesn't bother you? Like, what is your favorite feature? And then we can kind of come up with that treatment plan. Just having them know that aging is natural. It's a part of a normal process and it's beautiful. We just work with it. We can't really reverse it. We can just make it happen a little more gracefully.
And that's exactly what my friends and I all want, is we just want to age gracefully. We don't want to look like we're, it's my turn to be 60-ish, 64. I'm going to do that with grace. I don't want to look like I'm in my 40s or 50s anymore. I had my turn.
Natural beauty is huge for me. I will stand and scream it to the world. What I start a lot of my consults with, because I'd say majority of the time that's what patients are saying. I want to look myself. My goal is for you to look yourself. I don't want you to leave me and look any different. I want you to go home and no one really recognize that you've had anything done or that you're working on anything, yet they'll think, wow, you look more refreshed today. You look like you got a lot of sleep. Your skin is glowing. You are you and you're uniquely you, and we don't want to change